Okay, the last step in the examination, as I said, for the precordium is the auscultation. We have to know that the components of any stethoscope consist of the bell, the small distal part, this is the bell, and this is the diaphragm, the larger part, and this is the ear pieces. The ear pieces should be directed anteriorly like this to fit properly with the external auditory meatus, and initially we have to listen through the diaphragm. Both tubes or this single tube should not have any tearing or any cracking. In such a manner, I'll put the stethoscope here and I'll check it, whether the diaphragm or the bell. Okay, I'll listen over the cardiac area, starting from the mitral area, then tricuspid area, pulmonary area, and lastly at the aortic area, and asking the patient to hold the breathing if I heard any abnormality in such a manner. I'll put my left thumb over the carotid artery to hear and listen carefully for the cardiac sound, whether it coincides with the carotid impulse or it occurs after it. Over the herbs area, and here over the pulmonary area, and here over the aortic area. Then I'll return back again, but using the bell, and listening again over the mitral area for third and fourth heart sound, left ventricular, and over the tricuspid area, left sided, for right ventricular S3 and S4, and at the right side also for right ventricular S3 and S4. This is for right ventricular, this is for right ventricular, while here for left ventricular. Then I'll ask the patient to turn himself to the left side to check for the presence of mitral stenosis. تقدر تنتهي الحماضة اليسرى. Okay, in such a manner. يلا عشت ايدك هسه تقدر تقعد لي. Then I'll turn my stethoscope into the diaphragm and I'll check for the presence of diastolic murmur of aortic regurgitation at left parasternal or right parasternal. This is really the basic principles of the auscultation. When you want to auscultate the heart, you have to know that the components of listening should include the first heart sound, second heart sound, and any added sound. Added sound may take the form of a click, ejection click, prosthetic heart click, or mid-systolic clicks of MVP, and opening snap of mitral stenosis, pericardial rub, or the murmur. Really, we will talk briefly about the murmur. Murmur, when you listen for a murmur, you have to also perform timing for the murmur to know whether it is systolic or diastolic or continuous. This is one. Second, you have to know the grade of the murmur. Grading of the murmur, starting if it is systolic murmur, starts from grade 1 up to grade 6, starting from very soft murmur into very high murmur. But the most important point is that grade for a murmur which is associated with a thrill. That's to say, we have to know whether there is a thrill or not to grade the murmur. This is point 2. Point 3, to know the character of the murmur. The murmur, is it blowing murmur? Is it harshing murmur, rasping murmur, or machinery to and fro murmur, and so on, from the character of the murmur. And then you have to comment on the radiation of the murmur. Radiation is usually toward the blood flow. Most commonly, radiation to the axil of mitral regurgitation, radiation to the carotid of aortic stenosis, and so on. This is about the radiation. So we comment on the murmur. First of all, area of maximum intensity. Where the murmur is maximally intensified, being very loud, and character of the murmur, grade of the murmur, radiation of the murmur. And sometimes for postgraduate student, really the examination committee, they ask about the relationship of murmur to the respiration and for certain maneuver. Okay, I suppose that I will hear a murmur for this volunteer. Really, he's not a patient. Let's suppose that there is a murmur, for example, here. I had listened for it. So how I can perform this maneuver? First of all, when I listen to it, I'll perform timing. A murmur which comes with the carotid wave is usually systolic. That occur with the first heart sound is systolic, while a murmur which comes immediately after the carotid wave or immediately after the first heart sound is diastolic murmur. Murmur which occurs throughout all the systolic, through all the carotid wave or S1 and S2 is called continuous. So this maneuver is performed to time the murmur. Second, I have to check where the murmur is maximally localized from this area. This is area of maximum localization, and then the character of the murmur, and then for the radiation. For example, here if I hear a radiation till the axilla, or here if I hear a radiation, and then the effect of respiration, inspiration and expiration. حمادة هسه تاخذ وتتنفس بحلقك من حلقك. عشت ايدك هاي هي. Then I'll perform the cardiac maneuver. How I can perform the cardiac maneuver? We have many maneuvers usually, but what is performed? Hand gripping, passive leg raising, and ask the patient to perform Valsalva maneuver, and squatting and standing maneuver, and I'll show some of them. Now I'll put my stethoscope over the presumed area of maximum intensity, and I'll ask the presumed also patient that he will perform Valsalva maneuver in such a manner. حمادة بس تاخذ لي نفس. شوف ايش راح اسوي انا. من اخذ نفس وتصم خشمك هيك وبتنفخ هيك بحيث ما يطلع الهواء. اوكي يلا من اقول لك يلا. اوكي هاي عشت ايدك for a few seconds, and then I'll perform hand gripping. هاي ايدك عشت ايدك. Also passive leg raising. عشت ايدك. And then I'll ask the patient to perform squatting posture, and then standing from squatting. وهذا تقدر تجينا هنا. تقدر هنا تجينا. اوكي هسه اريدك تقعد على امام يدك. اوكي هسه تقوم. عشت ايدك. اوكي على راحتك تفضل استمر. Okay, while I had performed this maneuver, really, we have the mitral valve prolapse murmur and murmur of hypertrophic cardiomyopathy. Both these murmur increase with the Valsalva maneuver and increase with standing from squatting posture, while most of other murmur decrease with these two maneuvers. The reverse is true for other maneuver, that's to say hand gripping or passive leg raising and squatting from standing decrease mitral valve prolapse murmur and the murmur of hypertrophic cardiomyopathy, while increase the intensity of other murmur. Why I had performed or I had to check the effect with the respiration, really, or right-sided cardiac sound, whether it is a murmur or click, increase with inspiration, except the systolic click of pulmonary valve stenosis. Just this sound is the reverse of all the other right-sided cardiac sound, while the left heart sounds, including murmurs and the click, all of them are increased with the expiration and decrease with the inspiration. This is about the maneuver of the murmur. Really, these two maneuvers, as I said, the relationship with the respiration and relationship with a certain maneuver, really especially are required from postgraduate candidate. This is about the examination of the precordium. What is last to us is to perform or to show you how to draw a cardiac murmur. Yes, if I have a focusing here, really this is one of the questions of the examination, is to draw a murmur. We have to draw the first heart sound. This is S1 and this is S2. Also we can write another S1, and to decide where it is the murmur. Any murmur here is systolic. Any murmur here is diastolic. Any murmur over all these cycles are continuous murmur. This is as simple as that. So we can know that the systolic murmur is divided into ejection systolic or pan-systolic murmur or late systolic murmur. For example, ejection systolic murmur, that of pulmonary stenosis and aortic stenosis; pan-systolic murmur, that of mitral regurgitation, VSD, tricuspid regurgitation; and that of late systolic murmur, for example, for HOCM and mitral valve prolapse. While diastole can be classified into those which occur early, like that of aortic regurgitation, and that in the mid, for example, in the mitral stenosis; continuous murmur, like that of PDA. Really, lastly, I'll just show you the area of maximum intensity for the murmur. Here at the mitral area, one should expect to maximally hear the murmur of mitral stenosis, mitral regurgitation, mitral valve prolapse, and here to listen for the murmur of aortic regurgitation, tricuspid regurgitation, tricuspid stenosis, and pulmonary regurgitation. Here is to hear pulmonary stenosis, ASD, and PDA. Here listen for the aortic stenosis and maximally hear for the VSD murmur. And from these points, really you can decide what is the type of murmur. This is in general the examination of the precordium, and I am greatly thankful for you for your listening.